Hi, my name is Heidi Hill, and this is my final presentation for HCA 220 on long-term care. Long-term care is becoming a more common option for the elderly and aging population. Facility settings for long-term care include nursing homes, retirement communities, skilled nursing facilities, and veterans homes. It's important that long-term care settings provide quality care that is timely, safe, patient-centered, effective, efficient, and equitable. Problems facing long-term care. The first problem discussed in this presentation is an increase in the elderly population. There is a significant increase in people above the age of 85 and even in the age range of 65 and older. Care settings can range from assisted living and retirement communities, which provide minimal care, it's more of an oversight, to skilled nursing facilities that encompass a much higher level of hands-on care. One article that was published in Wolters Kluwer Health states, for many elderly and others with disabilities, independent living is a difficult goal to achieve. Many become too frail to spend their later years in their own homes and must move into institutional settings. With these aging people moving into institutional settings, there becomes an increasing need for housing and also for care providers. According to the Bureau of Statistics and Labor, one article states the job growth in the community-based care industries, which are labor-intensive, is correlated with an increased demand for services. Another problem facing long-term care is an increased life expectancy. Increased life expectancy causes people to need more money for living expenses for a longer period of time than they may have expected. It also has an increased possibility of folks having to go on Medicaid programs. That is a federally and state-funded program for those who do not have an income much above the poverty level. So it is an option to pay for long-term care. One article in the Elder Law Journal states Medicaid, a welfare program that pays for a long-term care provided by a nursing home, can also be conceived of as a form of insurance that has a deductible, the need to spend all assets on the cost of care, and a continuing copay in the form of the requirement that the individual spend all of his or her income for long-term care. So that program incorporates any extra money that you have must be put towards your housing in long-term care, and then Medicaid will pay for the remainder. Another problem facing long-term care is the reliance on pharmaceuticals. Medications are being used to treat chronic and age-related disease, and along with these medications is an extension of life expectancy because medications are preventing things such as stroke and heart attack, and it is also known that type 2 diabetes can be treated with oral as well as injectable medications. Another problem that long-term care is facing is rising healthcare costs. With an increased life expectancy, there's a likelihood of living in long-term care for a longer period of time than someone may have planned if they planned on that at all. And when living in a facility, there's a high likelihood of people having to pay out of pocket to use up their savings or until they qualify for Medicaid to pay for their long-term care stays. There are effects of problems on long-term care. For increasing aging population, the need for long-term care facilities to plan for capacity and census to determine the need for bed space and turnover. There is a study performed by Lee Y et al., and the point of that research was to be especially useful to long-term care policymakers in a state or nationwide given the worsening shortage of care providers and the escalating long-term care needs resulting from population aging. With the need for extra capacity and beds, there's an ongoing need for qualified staff and adequate staffing levels so that you can provide proper care to your patients and residents. Properly trained staff are necessary for facilities to function at an optimal level and be able to give that quality care. One way of looking at this is, according to Croth and Young, the preparation of each generation of health workers is just as fragmented and confusing as the healthcare system they will one day join. You learn things in school about how a system of delivery may work, but when you get out into the real world, depending on what is happening at the time, such as our current pandemic, the situation and the circumstances change, and you have to be able to modify what you've learned to fit and adapt to those situations. Another effect of the problems on long-term care regarding longer life expectancy, there is an increased need for bed availability. According to an article on Taylor and Francis Online, the number of long-term care recipients in the U.S. is projected to increase from 15 million, which was back in 2000, to 27 million by 2050, and spending on long-term care is projected to increase from 194 billion, which was in 2000, to more than 340 billion by 2030. Another effect regarding increased reliance on pharmaceuticals, we need educated and licensed individuals to administer medication to residents and patients. With staff shortages, typically the nurses who have to administer medication may feel the effects of not being staffed fully. That stress can get to them. They can have an increasing number of patients where they will not get appropriate care, and this can ultimately lead to a higher risk of medication errors, which can result in adverse effects for your patients or residents. Another effect of problems on long-term care are rising healthcare costs. Aging people might not have the money to seek care, or they live in rural areas and care would be expensive for them to obtain. People who are aging may also choose to save their money rather than spend it on health care. They may see health care as a non-necessity. Some recommendations to improve healthcare delivery. First, we should treat the whole patient and not just their diseases. This would include a spiritual perspective along with preventative care approach. James 5:15 states, "And the prayer offered in faith will make the sick person well. The Lord will raise them up." We also should provide incentives for those going into healthcare education programs. If the government could provide scholarships, discounts, or free classes for those working toward a healthcare degree, we might be able to increase our workforce so that we can assist facilities in having proper staffed levels. The number of care hours per resident per day delivered by NAs is an important contributor to residents' quality of care in long-term care homes. And that was from Bosgart et al. This is true. Speaking from experience, you have to have enough nursing assistants or certified nursing assistants to help you in caring for patients. They are the bread and butter, the lifeline for nursing staff. Those assistants help with ADL, such as bathing, feeding, meal prep, and without those nursing assistants available to us, we would have a far larger task at hand than we should, and that can really affect our patient care if we aren't staffed properly. Another recommendation to improve healthcare delivery is to treat patients with a broader approach. Providers of any care, this can be nursing assistants, caregivers, nurses, doctors, pharmacists, anyone who has care with any patient should be watching for signs of mental illness. This might help in treating mental health issues earlier in the process, such as depression, schizophrenia, these types of things. Another recommendation is to treat patients the way we would want our own family treated. This means we need to give the extra time to give good care to patients, and we need to treat all patients with respect and dignity. In conclusion, long-term care settings face many challenges, but there may be just as many ideas for improvement of care so that every patient is getting the care that they not only need, but that they deserve. Just as we've learned in this course that long-term care facilities need the same kind of structure and staffing to be successful in order to care for aging people in a dignified manner. Hospitals have their structure. Long-term care facilities also need that same type of structure, and that includes being able to staff appropriately so that we can give the care that we need to give and that these people deserve who are coming into our service. As Luke 6:31 tells us, do to others as you would have them do to you. We need to care for everyone who comes to us as we would want them to care for us. Thank you so much. It's been an honor to take this course from you, and God bless.